Hi, welcome to Navigating Your Child's Mental Health, Answers for Families, brought to you by Boston Children's Hospital. My name is Bethany. I'm part of the communications team here at Boston Children's. Before we get started, I have just a couple of housekeeping items. This webinar is being recorded and is also live on Facebook. The link to the webinar will be sent out to participants and will also be available on our Facebook and YouTube pages. We know you have a lot of questions and there's a chance we won't be able to get to all of them, but don't worry. Be sure to check back with us on social media and in Answers, our content hub, where we will continue to post relevant stories and information for you and your family. Today, we have two wonderful panelists to help guide our discussion. I'm happy to introduce Dr. Erica Lee and Dr. Chase Samsel. So without any further ado, I think we can go ahead and get started with this. I know we have some great talking points. So Chase and Erica, I will let you kick it off. I think you have some tips for parents regarding their kids' mental health and some signs to look for.
Yeah, thanks so much, Bethany. It's great to be with you all today. So the primary things that we're seeing right now is everyone's under a lot of stress, right? Kids are under stress, teens are under stress, parents are under stress. And two of the primary problems that we're seeing come up a lot are anxiety and depression. So parents, you really want to just be checking in with your kids. Like, yes, it's normal right now to be feeling a little bit overwhelmed. We've gone through so many changes. Things feel like they're always sort of up in the air these days. But really checking in with your kids to understand, are they feeling really sad and down? Sometimes they actually look cranky or irritable. It's a harder time controlling your mood. Maybe that's actually the bigger issue. Are they having any difficulty sleeping? Notice changes in their appetite? Are they worrying so much that it seems like they kind of can't get their mind off of things that are really bothering them? These sorts of things are making it hard for them, where it's not just sort of a come and go sort of thing, or maybe it lasts a few weeks and then it goes away. But now they're not able to do the things that they normally need to do at school or with friends or at home. You're definitely going to want to check in and maybe also speak with their pediatrician.
Yeah, I agree with Dr. Lee. I think one of the big things to watch out for too is isolation. I think anxiety and depression are the big symptoms we're seeing in so many kids and families all the time, but certainly increasingly over the past many years. And I think when kids sometimes get rid of an activity or maybe not hanging out with friends they used to, those things can be normal parts of adolescence and teenage years, maybe even elementary school years. But if kids are really turning away from almost all the things that they usually do and really not wanting to be around friends and family and other activities, those are great warning signs for depression and worrying about kids feeling sad, and are really, really important things to be asking about and seeking out about, as Dr. Lee said.
And then going along with recognizing these signs, how can parents help children develop positive coping skills?
The number one question that we hear so much from parents now, right, is like, what can we be doing? How do we help our kids understand this better? So I always recommend that parents start with the basics, right? So we have to be able to identify how we're feeling and to be able to name that and communicate that to people who care about us, who can help us, in order to figure out what to do to make ourselves feel better. And actually, the research shows that even just being able to name your emotions and identify, like, right now I'm feeling sad, or I'm feeling frustrated, or I'm excited, but I'm also nervous, that in and of itself is an intervention that helps provide some emotional relief. So helping kids just understand, like, well, what's happening for you right now? What's going on that might be making you feel that way? What are some of the thoughts or feelings that are going through your mind or your body? And now let's try to understand what we can do about that to try to make it better.
Yeah, Dr. Lee, I think so many parents and families often say to me that after they do those things that they didn't even recognize or understand their kid knew their emotions could be changed. That so many kids, they have an emotion, that's just how things are. And to be able to name it, as you said, and think about and talk about it and see that we can actually work on it, we can try to alter or change those things. That can happen is critical to development, just as kids, understanding those things across the ages.
Thank you both. You know, when it comes to parents feeling like they're a bad parent or they're kind of alone in this, what advice would you give to them?
Well, it's not just you. It's absolutely not just you. I mean, really, everyone is going through it, and parents are not immune from that, right? Parents have been asked to do so much. Parents are always asked to do so much in the world that we live in, but especially during the pandemic and everything we've been weathering just within the country and around the world in the last few years, parents have really stepped up to be heroes in their kids' lives. So the number one thing I say to parents is it's not just you. And the reason we know it's not just you is because we're in the midst of a pretty significant behavioral health crisis, not only in the Commonwealth, but around the country, because so many kids and teens are struggling, and parents too. So know that it's not just you. And don't forget to be kinder to yourselves, parents. I think that there's so much that you're doing that you often don't give yourselves credit for. I speak to so many parents in my work every day who are always telling me all the things they feel like they're not doing, or the ways in which they feel like they're not showing up for their kids. And they're not giving themselves credit for all the ways that they are, right? That they're trying really hard to be there for their kids, to balance all the things that they have on their own plates right now, and to make sure that their kids are okay. So I think parents need to also give themselves credit for the ways in which they're showing up, small and big ways, all the time.
Yeah, I think the concept of good enough parenting is a really important one here too, that you don't have to be the perfect parent. And usually striving to be the perfect parent is only going to lead to more distress on the parent's part. And it's going to be frustrating too, to see that you can't control and do everything. And I think we talk a lot about wanting to make sure parents recognize that doing a good enough job is what most kids need. And thinking about the ways you can be available, about the ways you can talk to them, about their emotions, their mental health, and meeting their basic needs, all of those things are going to be good enough for so many kids in so many situations now. And it might be important to show them as kids too, that they also don't have to do everything perfect too, right? Kids always respond to how their parents model things. And it's not just as important only to talk about things with your kid, but also to model and show them. They're going to pay attention to what you do and what you don't do. And so it's two different types of communication. The type that you're telling and asking them and instructing them around, and also what you show them. And I think to be able to show them it's okay not to do everything perfectly, not to be able to get to everything, but to focus on the things that are most important is healthy, not just for parents, but also for kids too.
Thank you. We have a bunch of questions that we've gotten in advance. We have some live questions now. Do you have anything else you would like to add before we start diving into these questions? No pressure.
I'm happy to take the questions, let's get right to them.
All right, now let's get to the questions. The first is, how can you help a young child with anxiety about attending school? And how do you know when it's time to get an appointment with a mental health professional?
This one's coming up a lot. It's coming up a lot. We hear this a lot, I think, in normal times, and especially during the pandemic with so many changes with remote learning. And are we in school? Are we out of school? What's happening with masks and not activities? A lot of kids have had a hard time going to school, so know that that's understandable. The first thing I'd want to know is what's getting in the way. So what's making it hard to go to school? Because there's lots of reasons why school can be stressful or feel overwhelming. Is it that I don't feel like I can follow what's happening in class? I'm kind of nervous around other kids or around adults, and I don't feel like I can say things because I'm worried I'm going to look stupid or they're going to judge me. Is it actually hard to pay attention or sit still when I'm at school and I'm not quite sure what's happening? Are other kids being mean to me? There's any number of things that might, and those obviously not an exhaustive list of reasons why kids might have a hard time going to school. So I'd want to understand what was happening there, and then to figure out there's something we can do about this, right? If it's a problem we can try to solve, do we need to work with your school team? Would it be helpful to see if there's some space for your child to see a school counselor? What are some ways that we can try to address the problem, so kids know it's not just that I have to sit here feeling bad and either I go to school or I don't and I avoid it. Let's try to understand what's happening and how we can attack it.
Yeah, we were just talking about parenting. I think don't worry alone. Dr. Lee is talking about all the different people that are resources and helpful to think about this question with you. School psychologists, guidance counselors, teachers that are working with kids, being able to get more information for them, being able to see what they think. These are folks that work with kids who are having a distress around going to school, being in school, transitioning to and from school all the time. Their input is going to be critical. And also, as Dr. Lee also said earlier, your child's primary care physician, whether it's a pediatrician or a family physician, letting them know. I think there's so many pediatricians and family physicians that Dr. Lee and I talk to on a regular basis who maybe the first time they heard that there was something distressing was from us when things had already gotten quite escalated, or there was a referral, or we had heard about some things going on for a while. And while family physicians and pediatricians can't necessarily solve all these problems, they hear about these things too. And they see them all the time. They have lots of different network referrals that might be able to be useful. And oftentimes, luckily here in the Commonwealth, increasingly pediatricians and family physicians have embedded mental health and behavioral health experts that could actually be able to see kids briefly or even sooner than some of the really long wait lists that are going around here in the Commonwealth and the country. So lots of different people pull in more expertise, right? Lots of different people that do this a lot are at hand, even though some of those wait lists to see some of the extreme experts might be a lot longer than all of us wished.
Thank you. That's really helpful. So this is an interesting one. As a parent, how do you help a child deal with comments such as saying, I don't like myself in early childhood? And how do you know if this is something to be concerned about and how to respond if they say it again?
This poor bunny. I totally love this question because I think lots of kids struggle with self-esteem, right? And I really appreciate that this parent is kind of keeping an eye on, I don't think it's just a throwaway comment. I really want to make sure that my kid's okay or that it's not a bigger issue. Again, I think just talking with your kid about like, what don't you like about yourself? What are you not liking? Because again, maybe it's like, oh, I'm not as good as my sibling at this thing. Or maybe I don't, sometimes kids say things even when they're young of like, I don't like the way that I look. Or I wish I could do this thing that somebody else could do. Or I don't think that I'm smart. Right. So trying to understand like what is it that's making the child feel badly about themselves, and then trying to explore that a little bit with them, right? Of like, well, like there's not just one way to do things, similar to what Dr. Sampson was saying about there's no perfect parent, there's no perfect kid, there's no perfect way to be. And every kid has their own wonderful strengths and talents. And how do we kind of help them identify those things and then build on them? So what are the things that you are good at? What are some things that we've shown that you're really strong or you're kind or you're brave? Even if you're not maybe the strongest athlete or, you're not as good at the math problems as maybe some other kids. And really trying to help kids have a little bit of that growth mindset of there are things we can do to improve. And there's no such thing as perfect and there's no one way to be. There's also just like so many great books out there that I think, so many children's book authors now have really kind of expanded this universe of really having these different affirming kinds of books for kids. There's lots of great books out there that teach kids about like, what do you love about yourself? What are the different ways to be smart? What are things that, you have talents in, even if they're not the same as other kids or your siblings?
I think you're highlighting something there, Dr. Lee, which is never assume. Right. I think we talk to parents all the time who are like, oh, it's got to be because of this thing. It's like, well, is it? And we'll talk with the kid and find out that maybe they're worried about something different altogether. So thank you. I love your approach of just ask. Keep getting the kid to talk. Even if you think you know what it is, even if you do know what it is that your kid is feeling bad about, they need some space to talk, and keep asking them, try to understand it more and more. And sometimes just the asking and hearing them talk might maybe relief and therapeutic enough in itself, and they'll see you as someone they can talk to about this, and you're receptive to that and will come to you from time to time, and you won't be as worried or anxious about whatever it might be that's going on. You'll feel more and more comfortable and more confident that kid will talk to you about things, and maybe you're going to find out something you didn't know, which is going to help you find a better book that's going to be able to have a kid who has a similar experience so they don't feel alone, or maybe, wow, there is some bullying going on at school and we need to do something about that, or maybe there's something going on distressing in the community with a friend or in the household, where just having more information is going to be critical. Sometimes kids, feel like that they're responsible for something that's happening, and they might feel guilty and not want to talk about it. So the more that we can encourage them to talk and model that it's okay to talk and we want to hear those things, the better we're going to be able to support our kids and also keep them safe.
Our next question from a parent is asking for some insight about why a child may have such swift emotional changes.
Lots of reasons. Lots of reasons. I think, sometimes it helps to, kids are obviously not mini versions of adults. That's very important to remember. They're very different stages of development. But I think it helps sometimes to parallel the adult experience, is like when we have a lot on our own shoulders, right? As adults, as parents, when we're stressed, when we're tired, when we're hungry, like we have a harder time controlling our emotions, right? And obviously for some kids, depending on what's happening for them psychiatrically, they may have an even more difficult time just sort of managing impulsivity, or they're a little bit more emotionally reactive. But oftentimes for kids, it's just that there's something going on, right? They're frustrated by something, they're feeling sad, they're feeling worried, there's something that's happening for them that's making it harder for them to, kind of keep things even. And so something really small might happen. And this is the thing that parents often say, like, oh, it just seemed like nothing, like just all of a sudden, I don't know, we didn't get the right pizza, or we didn't get to sit where he wanted, or like this store was closed and she got really upset. And it kind of seemed to come out of nowhere. And usually there's a little bit more going on. So trying to understand, is your child feeling a little bit more stress? Is there something that's kind of on their mind that's making them feel down or frustrated? And like maybe it's not that immediate incident. And when that calms down, let's try to understand what's happening. And of course, if it just seems generally that your child is really reactive, or it seems like this is getting them into trouble, they're getting so upset or so reactive that it's causing problems at home or school with friends, you probably want to check in with your pediatrician to see if you might need some further evaluation.
Yeah. I think another element to consider here too is you all know your kids best, right? You've seen them grow up, and there's all kinds of different temperaments and styles that kids have too. Some people may have a more reactive style or personality, and some people may have always been quite subdued and very slow to react or really hold their cards close to their chest, and a lot of kids and adults in between. And I think sometimes we'll get referrals from family members or from primary care physicians meeting kids that maybe have been quite reactive in their emotions for a really long time. And I think that's an extra consideration to take when thinking about having a therapist, because sometimes kids really need to learn extra skills about how not to be as reactive to everything that might happen in their lives. If this is a kid that's reactive to multiple different settings like school, home, out in the community, and has been for many, many, many years, there might have been something that's been happening or going on for a while. It might also be that that's a bit of their style and temperament, and that's going to take longer, more intensive therapy to try to help them learn and change over time.
Right. We have a lot of live questions to get to, so I'm going to start just going through these. The first one is from a parent who says their 8-year-old gets nervous about being able to fall asleep, and also bites her nails and cuticles often. What would you suggest to this parent?
So they're feeling a little nervous, right? So again, what's happening at bedtime? And I really empathize with this because I was a nail biter as a kid. It drove my mom crazy. I don't remember if it was around bedtime, but I was also a nail biter. So I know it's a sign of anxiety, right? We're feeling kind of nervous. We've got this like nervous sort of fidgety energy, right? It's just a way for us to kind of express that. So what's happening at bedtime, right? Lots of kids have trouble at bedtime. Is it that we're scared of the dark? Are we scared of monsters? Are we worried something's going to happen to me or to one of my parents when we're separated? So trying to understand, okay, what's happening at bedtime and what's leading to the nail biting. In regards to the nail biting, you can just get a fidget. Like, is there something else that they can use that doesn't maybe involve like leading to sort of ripped cuticles or maybe bleeding fingernails or something like that? Is there something else that they can squeeze? And then around bedtime, can we come up with a really soothing routine? Right? So what's our routine going to be around bedtime? If we already have one, like, should we take some slow, deep breaths together? Should we imagine being in a really peaceful and calm place as we're drifting off to bed? Would a noise machine or some aromatherapy help? If it seems like it becomes a much bigger issue where the child is either, normally was able to sleep in their own bed and now they can't, or used to be able to sleep without mom or dad and now they can't, that's probably something you're going to want a little bit more support with, and working with a therapist can help you kind of nip that in the bud pretty quickly.
Those are all great suggestions. I would say as a psychiatrist, people often have questions about medications for sleep. And what we usually say is of the top 10 medications for sleep, numbers 1 through 9 are not medications. That some of the practices that Dr. Lee talked about, really trying to work on sleep hygiene, sleep routine, having some skill building, relaxation, trying to find ways to worry about and intervene on things during the daytime and not right when you're going to bed, which I think we can all be honest, especially during the pandemic, we as adults could probably do a lot better too, are the things that we need to do. So many medications, while there's some that can help kids get to sleep, is not necessarily things that result in restful sleep, and can often be things that make kids groggy when they wake up in the morning trying to get going for school or on the weekend to do family activities, friend activities. So if we can do things with intensive support and therapies and strategies, or even avoiding therapy if some of these more sleep hygiene, sleep routine, relaxation skills can be started before, all the better. And there are no FDA approved medications for sleep in kids. And so there's a lot of different things we do that could help, but that's really unfortunately not going to be the quick fix that I think a lot of people hope it could be.
Thank you. So this is a really good question. How do you ask your child how they are feeling without accidentally tainting or influencing their response?
I love that question. I would do it really simply. How are you doing? How are you feeling? and doing it really as neutrally as possible. It's always hard because parents are so well-meaning, right? And you've got your own things going on. So maybe you're stressed, or maybe you guys are in the middle of doing something else and it might be sort of, rushed, but like really just take a moment, make eye contact with your child and really neutrally and calmly just ask, like, how are you doing today? Or could you tell me, 3 words that describe how you felt today? Or what's, sometimes parents like to do sort of what was like the high point of your day and what was one of the low points of your day. Really, to what Dr. Sampson was saying before, your goal is just to get them talking and to show them that you're really genuinely interested in the answer. I think a lot of parents are genuinely interested in the answer, but we're all multitasking all of the time. And so for kids, maybe they really do want to talk to mom or dad, and they really want to like look you in the eye and say, like, this is what's been going on. So really openly and non-judgmentally, like, how have you been? What's going on? How are you feeling? I want to hear about how you are. I think it can be as simple as that.
Yeah, I love it. Keep it simple. Less is more, right? I think just hearing that question, I bet Dr. Lee's thinking the same thing, but I bet there's a sense of, I need to over-explain. I need to tell people that it's okay, or like set the stage for you to talk. And really, I think the hardest thing to do, but most effective thing to do is, like Dr. Lee said, is just to ask and try to zip it, which is really hard for us to do as parents, but is so much more effective than us trying to explain about why it would be a good idea. And unfortunately, the first time you ask might not be effective. You might not get the response you want. You might need to keep doing this over and over. As Dr. Lee said, modeling is really, really helpful. You talked about, Dr. Lee, the high-low of the day, and that's a great concept that a lot of families are able to utilize, and around dinner table or on the ride, back from school or wherever it might be that you're going to commonly be together each day, to sort of just create the routine that everyone's going to talk about that, which means you as a parent should participate in that too. You might need to model again that this stuff is okay to talk about. We shouldn't be ashamed of our feelings. This is really important. I do want to know. And you might have to do that many, many times before your kids might open up a little bit more. Sometimes you might need to add some levity. So some people do high, low, funny, and everyone has to do a high, low, and a funny. Lots of different ways to really bring down the guard and to make people feel less tense and less defensive about things that are going on, to be able to hopefully hear more from your kid about what's going to be able to go on. I think the other thing to say about this, unfortunately, despite all of our efforts, we were just talking about being super parent and being good enough parents, it just might not be good enough. And as much as you would want to do and as much as you care about your kid, you really might need professionals' help to be able to have a good therapeutic relationship in psychotherapy with someone, to get your kid to open up and talk about really tough stuff. And for many kids, it's both. You need parents at home who are going to be able to do that, and you also need a therapist to be able to talk about some really big emotions and some things that are really challenging that are going on in your life.
And speaking of therapy, our next question is asking, how would you compare the quality of care provided by a therapist virtually versus in person? And if both are available, would you recommend one versus the other?
I love this question. This is such a great, thoughtful question. But my answer is that it depends. It really depends on the kid. It's so funny because, in my clinic, we were actually providing virtual therapy to some patients, before the pandemic started. So it helped that we had a little bit of a running start, but we also got to see that it doesn't work for every child and every teen, right? Like you would think in some ways with the younger generations that it'd be like, oh, well, they love technology. They're on FaceTime all the time. They're used to Zoom. And many of them hate it. They feel like it's really weird. They don't want to talk to you from their bedroom. There's different boundaries when you're at your house versus when you're in the therapy office, where you go in, you do your therapy, and then you're out, and it's a little bit different. So it really depends on the kids. And then there are some kids who they can't pay attention. Right? So there's too many things. It's too enticing to be on their laptop. We get into the Zoom filters. There's all kinds of things that make it really distracting and hard to sort of sit still and really benefit from the full sort of therapeutic space that we're trying to create when we're doing psychotherapy. So it really depends on the kids and the families and sort of what works for them. I always say when I'm meeting a new family, I'd like to see you in person for the first time. It's also important that kids and parents get to check you out. We often think of it like, oh, I'm going to see the doctor and the doctor's going to tell me what to do, but it's also important that you see, how do you feel? How do you feel about me or another therapist, right? Of like, is the fit there? Do you feel comfortable? Do you feel like, what I'm recommending for you is going to work for you and your family and is going to feel really supportive for what you need right now? And so it just really depends on the family. I wouldn't say that one is uniformly better than the other, but I will say I thought that virtual therapy during the pandemic would be more uniformly successful than it has been. I think a lot of families still prefer to come in person and have that nice in-person touch point. But of course, we can recognize that just with the pace of life and how much, again, parents are being asked to do and all the different things kids are being shuttled between, that virtual also has a lot of advantages in terms of expanding access to care, making it easier for families to come every week. So it's really a conversation to be having with your therapist of like, what do you think works best for my kid and my family? And then also expressing your preferences and needs as well.
Yeah, I think certainly if there's, availability of one versus the other much sooner than the other, and your kid needs help, don't turn away one because you think it's not going to be nearly as effective if your kid you think really is needing help and support. I think sometimes I am surprised about the kids that do well with virtual therapy, even as a psychiatrist and with expertise, and they do better than I thought, or vice versa, that they may have been maybe a little more shut down and they're on electronics all the time. I'm not sure they're going to do too well with in-person therapy, and they do pretty well. I think that there's some good evidence and studies in the adult world and population showing that virtual psychotherapy is actually very, very effective for adults, and some people feel like they can open up even more than they would in other ways. Obviously, it's easier to access for some families who might live really far away from wherever their therapist is or might not have any local options. There's also been some people that unfortunately feel like it's kind of lonely and they're not getting the same connection, or maybe it's not as socializing, or they can't really express as much over a video conference than they could in person. And I think you just got to figure it out. Like Dr. Lee said, you just got to talk about what are the goals and check in with your therapist about how it's going. I think it's always important whenever you're in any new psychotherapeutic relationship, if you're going to be meeting weekly, to at least give it 3 or 4 sessions for you all to get a sense of how things are going with the therapist, to maybe take stock after it's been 4 sessions and say, where are we at? How is this going? What are the goals and plans, and get a good sense of it, because usually just meeting one time with the therapist, unless it's just been a really, really challenging encounter, it's not going to be enough. It's going to take some time, and really encourage everyone to, in each unique individual circumstance with the therapist, do it, because sometimes it's just maybe not going to work out. And that doesn't mean that therapy doesn't work out for you or your kid. It means that you might just need to be in therapy with somebody else. And we can appreciate, with all the long wait lists that are out there, wanting to make it work all the time. But I think it's important to get the therapist's input. If the therapist tells you, listen, I don't know if, I'm just going to be the best fit for your kid, to really listen to that, because, we want to be helpful for kids and families, but we also need to be honest that, just like it is for me and Dr. Lee, there's certain situations and certain people maybe we're just not going to be the best fits for. It doesn't matter how many degrees we have on the wall or how many years we've been in practice, there's just going to be better situations for some kids than others. And it's important to find that out and to go through the motions to see what we can learn about it, and then move on to the things that maybe are going to be more helpful sooner rather than later too.
Thank you. We have some really good questions still popping up, so I'm going to keep moving right along. Our next one says, there are so many tragedies happening with youth suicide lately, and often you hear that parents had no idea and said their kid was happy and well adjusted. How do you handle this if your kid appears to be totally fine when they are obviously not sharing how they really feel?
So one of the things that's making me think of is that parents will often say to me, I wonder if my child is having thoughts about like wishing they were dead or wanting to harm themselves, and I don't know, right? It sounds like this is kind of maybe what this parent is thinking about. And the research shows actually that asking your kids directly, which I know can be enormously scary for parents, is actually the most effective way. Like if you're wondering, like, is my child having these thoughts, or like maybe they've been hearing about things, like lots of kids have been struggling, right? Like they've been hearing that their friends have been having a hard time. Maybe they know someone at their school or within their friend group that's had a hard time and needed some sort of emergency psychiatric care, or even had some suicidality. It's okay to ask your kids directly, like, have you ever had thoughts like that? Have you ever had thoughts of like wishing you were dead, or that it'd be easier if you weren't alive, or, even thinking about harming yourself? Have you ever tried to do anything to hurt yourself? Parents are worried, understandably, that this will like plant the idea in their kids' heads. But what the research shows is that it actually reduces the chances that kids will do something serious to harm themselves. Because sometimes maybe kids actually do want to say something to their parents. They want their parents to know, but they're scared of, how will parents react? I don't want to worry them. It feels like too much, especially for our kids who might seem happy on the surface and are really feeling depressed inside. They may feel like a burden, so they don't want to add their problems to other people, right? The thinking kind of gets distorted. And so I think if you're having any of these concerns that, my child has a lot going on and I'm worried it might be something serious, I would encourage parents to just directly ask, and then to say, like sometimes kids have thoughts and feelings like that. And I don't want you to sit with them alone, because those thoughts and feelings can be really scary and really painful and just feel really heavy. Like, I am here for you. If it's not me or your, other family members that you feel comfortable talking to, like we can find someone for you to talk to. I just don't want you to sit with it alone. So just letting your kids know, again, very calmly, non-judgmentally, compassionately, like you are there, you're open to hearing what they have to say, you can handle it as parents, and you just want them to know that you're there if things get really hard. I always recommend parents, just do another check-in.
I think we not only do we know this about parents, as Dr. Lee was saying from research, but we know this about ourselves. So folks like Dr. Lee and I, maybe if this was 15, 20 years ago, would have thought it was totally fine to just ask if kids are sad or depressed. But we know that's not sufficient, that we really literally have to ask about feeling suicidal, if they've ever felt that way, or they've thought about or know anyone that's talked about it before, and that not every single kid who attempts to kill themselves is necessarily depressed. Sometimes it's just an impulsive act. Sometimes someone got really upset about something or feel really ashamed of something, or got extreme bullying happened and they just did something impulsive that maybe they had thought about once in the past, but were not, sad or crying or withdrawn or isolated in the room necessarily. So to get to the question, it sounded like you said, my kid seems well adjusted, but how do I know? Well, we got to ask, because we can't just assume that kids that look sad and depressed are the ones that are feeling suicidal or that might attempt suicide. I think it's really important to directly ask. And also when you're asking, to say, well, if you ever felt that way, who would you talk to? Do you feel like you identify? Help the kid think about, so if ever a situation came up, who could I ask for help, or what would I do? Could that be mom? Could that be your aunt? Who is it? Who's it going to be? Just like having the kid think about that and to tell them, because maybe they're not going to tell you, but maybe they would tell somebody else in the moment. And I unfortunately see a lot of kids that have attempted suicide who come to our hospital. And I think so many of them had people that they told, either maybe they acted on it, and then immediately they had a person that they told. And it always, both from research and personal extensive experience, like the people that have someone identified and thought about it can think about in the moment when they're feeling overwhelmed, who they can reach out to or talk to about it. And that's the situation we all would want for, right? We don't want our kids to feel suicidal, but when they are feeling desperate, how can we give them some tools, or think about what you might do during any of those situations? In the same way that, you talk to kids about, if there was a stranger who asked you to come with them, what do you do? We should be thinking about this with our kids' mental health too. When you're feeling really sad and desperate, if you ever felt suicidal, who would you talk to, or what would you do in that situation? And even if it feels like it's not, the most comfortable thing to talk to, is really, really important. I know I keep talking about primary care physicians, but I think this is another really important one too. When kids are 12 years and older, the American Academy of Pediatrics has a recommendation across the board that all PCPs for kids 12 years and older are going to be asking that at annual checkups. They're going to be screening for suicidality at annual checkups too. And so thinking about partners, even if you don't have a therapist or psychiatrist or someone for your kid, who are the other partners too, where you're going to be able to make sure those things are getting addressed and screened, right? Don't miss out on those annual checkups. Those things are really important, not just for physical forms, your kid could play sports, or not just to get, your annual vaccines or whatnot, but also to be thinking about your kid's mental health and thinking about screening for some of these things that, if they're not asked, kids may not ever tell anybody until they do something impulsive or desperate.
Yeah, one last thing I'll just add to that, all the great things Dr. Samsel said is, one thing that we routinely provide in the hospital, especially when we're talking to kids and teens, is there are other ways to talk to someone anonymously, right? So two of the things that we always routinely tell kids, just put it in your phone. It doesn't have to go under anything. You could name it as a random friend that you made up, but making sure that they have the National Suicide Prevention Hotline number in their phones. It's a 1-800 number, 1-800-273-TALK is the number that they have it in their phones, because it's 24/7. They can call, they can talk to someone entirely anonymously about how they're feeling, especially if they're having these really difficult thoughts. Sometimes it comes up in the middle of the night. Sometimes they don't feel like they can talk to anybody else, even if you've made all of your best efforts, parents, to let them know that they can come to you. And then there's also a text line. right? That kids can text the word home to 741 741. It's also 24/7. And these are trained crisis counselors who are there to help talk to kids and teens, when they're having these really difficult thoughts. So that's another way too to sort of, know that they've got some backup if they don't feel comfortable talking to even anybody that they know.
Thank you for all of that. Another very thoughtful question from a parent. They say parents often can't fix the problem. How do we sit with big and small sadness, upset, and disappointment that we wish we could help a child with?
Yeah, I really appreciate this question too. It's so thoughtful and loving from whichever parent asked this. It's really, really hard. And again, it's not occurring in a vacuum, right? Like parents are experiencing all of these different hurts and worries and, really feeling what your kids are experiencing. And you're also going through any number of other things that you have to go through with the trials and tribulations of being an adult and a parent. I think it's okay to take time and just acknowledge that yourself, that it's okay. It's okay to feel those things, and that your instinct to feel these difficult emotions is because you care and you love about your child so much and really want their well-being to be such a priority in your life. And then also taking time to know that there's no way to make our way through the world without some level of these things, right? So unfortunately, there are kids who experience a higher number of, tragedies or traumas or hurts throughout their life, but there's no way to kind of go through life without experiencing these sorts of ups and downs. And the way that I often encourage families to think about it is, no one is ever going to have a time where they aren't going to say like, oh, I never felt sad again, or I didn't feel worried, or I didn't feel frustrated, or I didn't feel annoyed. But actually, it really is, how do we respond to it? So similar to what we're teaching our kids is like, what can you also do to take care of yourself, right? What can you do to make sure that you are following all the basics you tell your kids to follow, like sleep and diet and exercise, making sure you're having human connection, making sure you're making time to talk to another adult. That's something that really goes by the wayside with parents. We're just talking to kids and thinking about kids all day long. Is where's sort of your outlet to sort of manage your stress and get that support around the difficulties around parenting. And then really knowing you have this powerful opportunity to say to kids, when we're going to have times when we feel sad or low or frustrated or worried, we can do something about it. And maybe we can practice those things together. And normalizing for your kids, like Dr. Samso was saying before, like sometimes like I get sad too. Sometimes I feel really frustrated. I had a really hard day at work and I was really annoyed. And then I tried to do this thing to reset. And it's not only about modeling it for your kids, but it also probably help you feel better too, to say like, I'm going to be kind to myself. It's understandable that I'm having a hard time with what my kids are going through. What can I do to reset, breathe it out, try to feel a little bit more positive, and how can I also model that for my kids? But it's enormously hard, and parents really have been so stressed watching what their kids have been going through the last few years.
I think the audience is finally catching on, Dr. Lee. We're going to keep pounding on, this take-home point, which is modeling. Like as parents, we have to do things to show what we hope our kids are going to do. We've got to really, I think it can't just be do as I say, not as I do. It's got to be hopefully do as I say and also do as I do. I think there's so many parents who want to fix what's happening because that's a natural parent instinct, and 100% agree with Dr. Lee that it's about what happens next, right? You can't go back in time. You can't prevent that thing from happening, but what can we do next? And I love all those points about active coping and supportive listening is like the technical term that Dr. Lee was using too, where like you're really listening without trying to fix it, which is hard, right? Just like the question of, tell me how you're feeling, and can I not talk and just let my kid talk too, but to really just hear how they're feeling without having to jump in and try to fix right away, or jump in to try to tell them, especially some of the mid to older teens, right? They're going to be like, I don't want to hear what you have to do, right? They're going to do everything except what you tell them to do, but listening to them is still something they value, and wanting to hear what's happening and what they're going through. I think modeling active coping is going to be really, really good too, but there's a couple other things that I think families find really helpful, which are really well supported over decades and decades of research, which is one, distraction, which is a type of coping, but I think it's really important for kids to see if something bad is happening in the world or something bad has happened to them, that it's okay for them to focus on other things. Structure is really helpful. Having school, having activities outside the home, or things you might do with friends or families is really, really important to have that regularity, that consistency, and that distraction. And opportunities also for altruism, so giving back. Sometimes when people are feeling so bad, one of the most helpful things they can do is to do good for others. Maybe they feel like they can't help themselves, but being able to participate in something that's giving back to Ukraine, or something that might be like a food or shelter kitchen that's happening on a weekend, or giving back to your community in some sort of way. All those things can be really, really helpful active coping means for kids and families. And being able to not just have distraction altruism, but humor, being able to like find some joy, to be able to find ways to laugh or joke about things. Sometimes kids, and maybe adults too, when bad things are happening, feel like they can't laugh, or they can't find some humor, or they can't keep things light. But that's really, really important for us to do as human beings. And again, decades of research have confirmed that these things are all really, really helpful ways when we feel like there's so much bad going on in the world. What are some ways we can inject some good, or at least model to say, and we're still going to be okay?
Next up, we have a parent asking how they can guide their 20-year-old son to see a therapist.
This is tough on two levels, right? This person is legally an adult. And generally our young adult men are not particularly keen on therapy because our society does not encourage it. I guess I would want to know, why, like what were sort of the reasons why you thought that seeing a therapist would be helpful. And I often find in these kinds of conversations, we can get into these power struggles, right, between parents and kids, or parents like, I think you really need to do this thing. And like Dr. Sampson was saying earlier, like starting with teenagers and on up, and sometimes even younger kids on up, what they want to say immediately is no, like I don't want to do the thing that my parents recommend that I do. So there's initial resistance, but really sort of checking in about like, well, what is this individual's goals? Like, what are the things that you want for yourself? What's the kind of life that you want to build for yourself? And are there things that are going on right now that might be getting in the way? And are there ways to get you support so that we can help you reach your goals? Like, I think harnessing that sort of, internal motivation that an individual has for themselves in their own lives is going to be the thing that sustains any kind of, movement forward, right? Because people will do things for other people, but generally, especially as we get older, we really just do the things that we want to do or that we're willing to do. And so can you sort of pull on like, what do you want for your life? Is there a way that an outside person could help you get there? Another thing that I often say to the teen boys and then the young adult men that I work with is, fine, your parents want you to do this thing, or maybe your teachers want you to do this thing, or your boss wants you to do this thing, whatever, but like, what do you want for you, and what's the best way to help you get there? And how maybe talking to somebody who's completely independent, who's just there for you, because once you're an adult, you have legal sort of right over your own care, right? It's not for your parents, even if it's in the same direction of what your parents would want for you. So if it's just for you, would it be nice to have someone who's neutrally there, right, who has no vested interest other than your well-being and what's best for you and helping you reach your goals within reason, assuming the goals are appropriate? Wouldn't that be kind of freeing to actually have someone confidentially to talk to help you work through the stuff that like is actually very separate from your parents? So sometimes people also find that like, oh yeah, I'm thinking of it as like, because my parents suggested it, that means it's for them, but actually really this would just be for me. And because of confidentiality and because that person's, primary interest is in what's best for me, maybe that actually helps me reach my goals, and I don't have to think about the parent piece as much. So I don't know if that's helpful, but.
Yeah, it's so hard. There's going to be so many different, questions, or I have questions about what's going on with that person and what their needs are. But I think you hit the nail on the head, Dr. Lee. I mean, what does that person want? I think developing as a very young adult, which is like the phase of life he's in, it's a time of identity searching, and it's also a time that so many young adults have a lot of anxiety and depression in that process, and trying to make it about what he wants and what he's hoping for and looking for. I would strongly discourage demanding or having consequences. If you don't go to therapy, you won't get XYZ or those things, because it's just usually not going to work out well. But really trying to align with your young adult child to say what are those mutual things that we can do together. I often get referred to a lot of boys and young adult men, because I think it's oftentimes that maybe they're going to feel more comfortable or okay talking with a man, and there's unfortunately just not going to be as many male therapists. So I think there's lots of different ways in which it's really important to stress, what his goals are and how that would be something motivating. And it might have to be a multi-year process of showing that you care and you think this could be helpful, and trying to think about different specific things that came up, and might also be useful if he has some family members or friends who are also in therapy that he really respects and trusts, to have those conversations, versus sometimes what happens with a parent when it's a little more antagonistic, or I don't know what to do, or I'm fine, or this is not going okay. But, is there an aunt or uncle or a close friend of the family or one of his friends who has been in therapy? I think unfortunately it's one of those things that we don't always talk a whole lot about, as family members and maybe even as friends that were in therapy or been on a medication for our feelings or emotions before. But I think being able to think about who's going to be the best person to deliver this message, who would be most influential, who's this person most respect, might be a way if you're having challenges now.
Thank you. Well, now we're moving on to twins. So with twins, how might you minimize the constant comparisons they make about each other's strengths, appearance, behavior, and more? This seems common for siblings, but off the chart for twins.
Yeah, I can really empathize with that. It's really hard, especially we don't know if they're identical, but if they also look the same or similarly, it also becomes challenging. I think it really helps to emphasize each person's individual things. Like the comparison to this parent's point is very common and very normal, right? And what are the different ways in which we're not going to be exactly the same? And how can we really highlight the positives, right? So here are the things that I really love about you, and here are the things that I really love about you. And what are the things also that you care the most about? Kids, I think, do have very different interests, even when they're twins. And so sometimes there's overlap and sometimes there are things that are actually really different. And how do we kind of help them nurture those identities? One thing I've also heard a lot from parents of twins is like making sure that they have some separation. So sometimes it could be like, oh, they're both really into art, but one of them is really into art and one of them is more into dance or music or sports. And so how do we make sure that they're not necessarily always doing the same thing at the same time? Of course, the caveat to that is that parents can only be in one place at one time. And so I know the juggling act is really hard with managing all the activities, but really helping kids kind of start to create their own paths so that they have their own areas where they feel like I can figure out, where am I in this space? What is my identity in this space? Is this something that I'm really passionate about and that I have talent for and that I want to commit a lot of time and energy to? And I don't actually have to think about my sibling at all in this scenario because we're actually just doing two different activities, even if some of our activities are the same. Sometimes that can help create a little bit of that differentiation too.
Yeah, it's especially challenging if twins have the same exact interests all the time, right, Dr. Lee? And like, oh, it is getting really, really competitive. Being able to have that differentiation and separate things nurtured. I think the parents that seem like they've had the most success helping their twins differentiate are ones that have found out, however it can in their family, being able to support separate interests of the twins and really reinforcing that. And I think on top of that, being able to really celebrate those individual differences is something helpful. Like we talked about identity formation, and differentiation, but I think being able to do that, and if you can, have the other twin help celebrate whatever the other twin is doing. So you start modeling for them to get in a process of appreciating each other for their differences and not trying to be as competitive about it, but celebrating. Because I think many teens, and there's lots of great books about this. There's lots of great twin studies where people follow twins for 40, 50 years, where twins talk about over time, the more they've been able to support each other, the more they become the best ally, not a parent, but the best ally for each other in being able to help differentiate. I'm not the same as my twin. And also my twin is doing a really great job and really trying to back them up and defend them and support them. So I think being able to do that sooner rather than later will hopefully help in a long trajectory for each of your twins too, and may also help you in the long run be able to not feel like you're the only one carrying that torch for each of your twins, which, as we talked about, there's so many things going on, it's really tiring, and how you can enlist your own family and kids to be helpful and supportive of each other.
We have another really good question. I love this one. What are your thoughts on the entire family being involved and engaged in therapy?
I love it. I mean, Dr. Samuelson and I obviously are very pro therapy, especially when we're working with children and teens. The more involvement from primary caregivers, the better, right? Because if you think about it, yes, even if I'm seeing a patient, once a week, every week, they're only in my office for 45 or 50 minutes. And the rest of the week, they're out in the world. They're with their family members, they're with their friends, they're at school, they're at activities. So you all are the experts, like Dr. Samuelson was saying earlier, right? You know your child best. And the more involved you are and the more consistency you can create. And again, just normalizing this conversation around, like when things are difficult, we use coping skills. And that's just the way that, our family works. So this is the way we respond to when things are stressful or unexpected things occur that might feel difficult. And so the more that we can kind of normalize that conversation and make it a family thing, the better. And parents really are critical partners in all of the work that Dr. Sampson and I do. We really can't do it without parents and on all of these people that are so important in a child or teen's life. So the more involved, the better. And then I'm not sure if this question was actually referring to like family therapy, but family therapy also can be enormously helpful for families, even if you're not in crisis, right? So a lot of times people think of therapy, and obviously we've been talking about it a lot today in this context of like, oh my gosh, something's really gone wrong, or my child's having these really difficult thoughts and feelings. What are we going to do? But family therapy often is just about understanding dynamics, right? How are different relationships formed? What are the sort of like more vulnerable spots? What are some tricky communication patterns we might get into when there's conflict, or when people, just aren't getting along? And so family therapy can also be enormously supportive in that way of creating this sort of like neutral space where you've got someone who's a trained professional, who's also a little bit of a mediator, to help you all see each other's perspectives and help you all communicate better and strengthen your attachments within your family. So I'm very pro all of those things.
I love the phrase, it doesn't have to be a crisis. I have a similar approach or explanation in talking to families that no one, became a family and was given a handbook about how to best communicate or to manage their emotions, right? These are all things we just kind of come across. And like anything in life, if you were studying to be a pilot, or like you were going to play tennis, right? We know that like getting lessons and working with a professional is going to make all of those things so much easier. And so it doesn't have to be that there is a failing or you're a bad parent, as much as you just want things to go better. You want things to go easier. And these are investments in yourselves, investment in your family, for your kids to be able to learn even better strategies and communication styles and emotion regulation that they can take with them for the rest of their lives, not only just helping right now, but are going to serve them well forever. It's just such an incredible investment that you can make. And so I think every family could be in family therapy, right? To Dr. Lee's point about you don't have to be in crisis. Every single family, it doesn't matter how well you think things are going, they could always go even better. And hopefully you can help model that and send that message to your kids, or if your spouse is not wanting to go into family therapy. I think one of the classic things family therapists will say though is, wow, if you try to wait for every single person to get on board, family therapy may never happen. And sometimes only half the family is going to show up at family therapy. And guess what? That's okay. And you know what tends to happen after a couple sessions? The family members who said they were not going to go are like, wait a minute, are you just talking about me the whole time? I got to show up to at least see what's going on here. It's a very common phenomenon that happens in family therapy or even couples therapy all the time. It may sound weird to hear, but in couples therapy, it's a couple, right? But if one person shows up to couples therapy by themselves or a couple times, guess what happens? The other person and the coupling shows up too. And I think that being able to continue to show it's important and to go, and having other people come on a little bit later, family therapists are skilled. This is what they do, and helping people not feel ostracized and being able to make sure that people feel like it's okay, even if they're coming later into the fold.
We have time for one more question. This went by really quickly. The last one I will ask you from our live chat is, as a parent of an LGBTQ plus kiddo, how can you aid your child in navigating the hate they might experience when you cannot, as a parent, be there to protect them?
Oh, I love this question. And it's really it's been so awful. I mean, there's so much happening in our country right now that is just really, really painful and hateful. So I really feel for this family. I think the number one thing to remember is that being there for your kid, I know Dr. Sales and I have talked about this a lot, but it's in some ways underrated, right? We're all talking, these parents all have these really thoughtful and loving questions about how can I be there more for my child? How can I better understand what's happening for my child? But what the research is showing, especially for LGBTQ plus kids, right, is that like having that consistent family acceptance and knowing that you have family there that really accepts who you are and affirms who you are and has your back, even when the world has not yet caught up to what quality should look like, is enormously protective and helpful, right? So checking in to let your kids know, like, what are things that we can do, right? So yes, I'm not going to be there with you at all times. So maybe similar to kind of some of the safety plans that Dr. Sampson was talking about earlier, right? That do we have a safety plan for what happens if you're in a space and you're not feeling safe? Like, what's going to be either like the plan for who you're going to get in touch with? How are we going to make sure that you feel safe? What are you going to do? If it feels kind of weird because it's a social situation, can we come up with a plan for like what your exit strategy is going to be? And then also, how can we maybe feel a little bit more empowered as a family to get involved in advocacy? right? So the power of the voice is not a small thing. We may not be all the way at the top, but we are able to sort of unilaterally make the decisions that we think are best for our society, but we can advocate. You can get your voices out there if you feel comfortable, you feel safe, you can share your story, you can be out there really lobbying the people who have the power to make those decisions, to really do the things that your family needs, and to protect the rights that your family deserves. But it is enormously hard. And so I can imagine, such a thoughtful question means that it's a parent who's really there for their kid. And I know that that has an incredibly powerful impact.
And unfortunately, the reality is so many of our kids are exposed to this all the time, even if it's not firsthand in their own community, which is unfortunately really, really high numbers of kids and youth through social media, or hearing about a friend's experience or a family member's experience. And so oftentimes it's that kids have already been thinking about these things, or maybe even already worry about these things, and it's unnamed. Yet another thing of like, what's going on with you? What's the highs? What's the lows? Importance in checking in with your kids. But as Dr. Lee said, proactively addressing the situation with your kids and planning with them when that time comes, or if that time comes, how to do something that's been scripted. Because all of us, this is the science that Dr. Lee and I know, when we get flooded with emotion, our frontal lobe, of our brain, our rational part of the brain sometimes gets paused or cut off, and our emotional brain might take over. And if we have not rehearsed something or thought about what we might do, or imagined that we'd be in a situations where our emotions get so high, we might do something we regret, or we might do something that's not helpful that could make the situation even worse. So really talking with your kids and thinking about those things is not going to make things harder in the long run. It might be distressing for them to talk about it and address it, but it's really, really critical. And it's hard for me to think of any kids, especially tweens and teens, who are not exposed to these things and don't think about these things. That it's just been so apparent. I know we've had questions in the chat about, what do you think about social media for my 10, 12, 14-year-old? Well, we can also say, even if you limit social media, they're going to get exposed. They're going to see it at school, through their kids' social media, or their phone, or they're going to hear about it. And we really need to be doing as much as we can, not to stay ahead of it, but to just try to keep up. Really, really important to address these things with your kids.
Well, Dr. Lee, Dr. Samsel, I want to thank you so much. We've had some incredible questions today. And before we wrap up, I would just love to ask both of you if you have any final thoughts to share.
One of the things I've been telling parents a lot during the pandemic is that, in the research, right, because obviously before the pandemic, we hadn't had a pandemic in a long time in our country, so we didn't have good research on what this would do for kids and families. But what the research around the world looking at resilience in kids when they've undergone really significant traumatic events, all different kinds of global things, shows is that the number one predictor of how kids are going to do and how well they bounce back is having consistent safety with at least one caregiver. So again, this is always the message, but do not discount the incredible power just that you being there, even if you're not able to do all the things you want to do, even if there are days where you argue with your kids, or you feel like you said the wrong thing, or you fell short, or something that you tried to do didn't land the right way with your kid. Know that you can, when you keep showing up and you are there and you say, I'm here for you, and I'm not always going to get it right, but I genuinely care about you and I want to help you figure out how to make things better when they're hard, is incredibly, incredibly important. So know, parents, that just showing up and showing in day out really matters a lot for your kids.
Yeah. Thanks, Dr. Lee. That's awesome. I think mine is that it's okay and important to ask for help. 75% of all mental illness starts before the age of 14. So before kids are even late adolescents and teens. And I think there's so many misconceptions out there with mental health stigma and worry and concern for kids and for parents and families. And I think it actually takes more strength to ask for help than to pretend everything's fine to go it alone. That's actually the easy route, but unfortunately, that's going to be the route that hurts the most. And that is delaying things, that's letting them worsen and fester, and leads to much more challenging outcomes than kids who get more help sooner and more consistently all the time. And I know that can be a scary thing for patients, for families. It's a really hard thing with long wait lists and the mental health crisis and shortages. But unfortunately, I don't think this crisis is going away anytime soon. And I think if we just push it away and we're just hoping for it to get naturally better on our own, folks who are doing that are not going to have it as easy, as weird as that sounds. They're not going to have it as easy over time as the ones who are really trying extra hard to do something about it sooner rather than later. So when in doubt, talk to your pediatrician, talk to your school psychologist, talk to your guidance counselor, talk to your kids' teachers, and, get your kids into therapy when you're worried. Do not worry alone, and try to get it addressed as soon as you can. It's never too late. Go ahead and do it now. Woulda, coulda, shoulda, but try to do it, when as soon as possible when you're recognizing that something's going on, and never feel like it's too late.
Well, thank you both again. And just as a reminder to our attendees, we will be emailing out a link to this webinar. It will also be available on our Facebook page and our YouTube channel. And we thank you all so much for being here. Thank you, Dr. Lee. Thank you, Dr. Samsel.
Thank you.